Okay, we'll go ahead and get started. Again, sorry for the delay, but we want to welcome everyone to the Good Systems Postdoc Interest Group Research Presentation Series. This is the second presentation in our series. I'm Tara Zimmerman, a CI 2020 postdoc fellow working with Ken Fleischman in the iSchool, and I am honored to introduce to you today my fellow postdoc, Robert Bautista. Robert is a Bullard Research Fellow at the School of Information here at UT Austin, and his research focuses on the socio-technical aspects of information and communication technologies, such as smartphones and social media and even blockchain. And he does that in both healthcare and non-healthcare contexts. Robert's talk today is entitled "The Role and Impact of Healthcare Professionals in Correcting Health Misinformation in Social Media." He will have some time at the end for questions, so please jot yours down and be ready with those at the end. And in the meantime, while Robert is presenting, feel free to turn off your camera, mute yourselves, and then we'll all come back together on video for our question and answer at the end. Okay, I'm turning it over to you, Robert.
Thank you, Tara, for the introduction. So I'll just have to share my screen for a moment. So are you able to see my screen right now? Yes, perfect. So my presentation is about the role and impact of healthcare professionals in correcting health misinformation on social media. So that's one of the topics that I'm working on for my Bullard Research Fellowship. And I'm really honored to present to you some of the findings that are already made for this project. So to set things straight, our topic is on health misinformation. So health misinformation is, we define it as any health-related claim of fact that is false based on current scientific consensus. So I like the way that it is presented here in the picture. It is, the more that we share it, the more that it spreads around. So that's currently what health misinformation is. And it's a big problem right now. Even before COVID-19, the United Nations and the World Health Organization recognized it as a global health threat that may influence people in making poor health decisions. But right now, health misinformation is one of the topics that the United Nations and WHO is really concerned about, simply because it does not it affects us in terms of decision making. And COVID-19 is the first pandemic in which we're not only concerned with the problem in terms of the virus, but we're also concerned with the infodemic of misinformation, as what the United Nations Secretary General mentioned about this tweet. Currently, what they propose is that to combat health misinformation, there are ways that people can do about it. And one way to do that is to establish digital first responders. And they refer to digital first responders as people that would correct health misinformation on social media. And as a healthcare professional myself, I'm interested with the phenomenon now that healthcare professionals are being digital first responders. We know that healthcare professionals now are in a war-like battle with COVID-19 in the hospital front lines. But to some extent, others are serving as digital first responders, wherein they're helping correct health misinformation using social media, as what is reflected on these news, such as those in the Twitter. There are some in the YouTube. Some are using TikTok for doing this corrections. So unfortunately, if you try to read some articles about it, what you can see is that the literature is mostly on encouraging healthcare professionals to correct health misinformation on social media. So the literature is usually stuck there. So what are some of the current research gaps that I identified based on this area of research? First is that there's not much research to show how do healthcare professionals correct health misinformation on social media. We don't know how they do it, what's their practices, what strategies do they use. Next is that what are some of the factors that predict healthcare professionals' intention to correct health misinformation on social media? And finally, what is the effect of the corrections posted by healthcare professionals on health behaviors? So we don't really know much about it. So that's why I'm conducting this research. And in doing this research, I have conduct for the span of 2 years of the Bullard Fellowship. I'm currently doing a phase one, phase two, phase three. I've already finished phase one, which is the interviews, and already published the results, and I'll be sharing the findings with you right now. And also, I also recently did a survey on it and will be presenting some of the preliminary findings. And I'm currently in phase three, wherein I want to know the impact of the corrections. So overall, this like 2 year project in terms of this research topic. So let's go over with phase one. So in phase one, I'm interested to know to describe how healthcare professionals correct health misinformation on social media. The goal here is to create a framework to understand how they do this. So in doing this, I interviewed 15 registered nurses and 15 medical doctors, all of which are active on social media. So the fundamental question here is this: how do healthcare professionals correct health misinformation on social media? So the first step here is that they get exposed to questionable health information. And once they get exposed to that, they're more likely to authenticate it. So it all starts with authentication. So, what are some of the examples of acts of authentication? What are the processes in it? The first part is that they do some internal acts of authentication. So it means that you're going to authenticate a social media post using one's knowledge and skill based on what you saw on the screen, which is for example, a Facebook post or a tweet on Twitter. So some people would check who the author is. They won't really check by opening a web browser. They'll just look at the person's name on that post and whether that person has a verified account. Is that person a healthcare professional? Does that person have the background? Like sometimes there are some Twitter profiles that would say that they're a medical doctor or a registered nurse or a different healthcare professional. So people would look for that. So healthcare professionals would look for that kind of information. Next, that they're gonna check for cues within the tweet or the Facebook post. So what are some of the examples of health misinformation cues that my interviewees identified? So these are some of the cues that when they see it, most likely it would contain health misinformation. So number one is like the post seems to appear like an ad. Next is it has a conspiratorial tone. Next is lots of grammar mistakes. And four, there's no cited reference. And even there's a reference, sometimes the URL which links to the source is that it's dubious. It connects a fake news or unreputable source, and it pretends to be authoritative, and to some extent, it's somewhat sensationalized. Aside from that, they're gonna check the topic. For my interviewees, there are certain topics that are prone for health misinformation. The top three would include vaccines, which is really something that we already expected. Number two is something that is related to diet, like weight loss regimen, detox, juice, weight loss supplements. The third is like alternative medical treatments, like herbal. This mostly linked with homeopathy, which is use of alternative medical treatments. So those are some of the topics wherein health misinformation is somewhat affiliated with. So once they see that it contains misinformation, or to some extent, sometimes they couldn't really judge it based on just the post, they do what we call as external acts of authentication. So they do this if internal acts are insufficient for authentication. The next step is to actually authenticate it using other sources aside from one's knowledge and skills. So one would actually do a background checking of the author. So they're gonna examine who the author is. So they want to know where's the author affiliated with, who where is the person employed. They want to see whether there's a conflict of interest. The next is checking past posts. It means that they want to actually know whether this person has a history of posting health misinformation in the past. The reason is that if you do this in the past, you're more likely to repeat that, and people tend to be consistent with that. They're gonna also examine the content, which is if there is a URL link that is posted on that social media post, they're gonna link it to see whether what is posted is congruent with what is on the link. And to some extent, there are some posts that don't have the link, so they're gonna cross match it with what is available on the literature, like journal articles, the books. Does it cross match? Is it congruent with what is currently known right now? So once the post contains health misinformation based on internal and external acts of authentication, they authenticate it and see that there's some misinformation about it, or based on their own assessment, based on internal acts of authentication, they will move forward with what I call the acts of correction. So the acts of correction is composed of two parts. The first part is they're gonna prepare for the correction preparation. So they would prepare the message to correct the health misinformation. So the first thing that they're most likely to do is to do a reflection. They're gonna need to reflect because they need to know, why is this person posting health misinformation? What are the needs of this person? Do I need to respond to this person? Yes or no? So they need to reflect on their own whether they're gonna correct the on how they're gonna correct the misinformation. And under this reflection, they would actually be guided by three things. So one R is what I call the reveal, which means that they need to insert sources, citations, references to support their correction. So it's not only sufficient that you say, oh, that's wrong. This is what CDC says, and you need to provide the link of what CDC says about, for instance, COVID vaccines. So next is that we also need to relate. They need to adjust the language that they're using. It needs to be relatable. It means that healthcare professionals need to communicate it in a general audience, that they need to avoid jargons, and they need not do some lengthy posts because it might be TLDR, too long, didn't read for most people. And the final thing that they need to observe is that to always be respectful. So there's no way that as a healthcare professional, you always need to maintain a professional attitude, whether it's communicating with the patient or to the general public. So they're healthcare professionals. Always need to maintain a position of respect. And they also need to give respect to people, no matter how uncivil people become on social media. Once they have prepared the correction message for the health misinformation, they've actually transferred to the next step, which is the correction dissemination. So the dissemination is that there are four ways that they would disseminate the correction of health misinformation. There's your private priming, your public priming, private rebuttal, and public rebuttal. So let me just go over to some of these strategies, because this actually answers the questions: how do healthcare professionals correct health misinformation on social media? So the way that they disseminate their correction is based on two dimensions. The first dimension is the means of correction, which is either a priming, which means a forewarning, or a rebuttal, which means a direct contradiction. The next is that they would be either disseminating the correction on a public means and a private means. So public means everybody can see it, and a private one is like for followers only. So let's go over all of these correction methods. So private priming is that you just privately post or share credible health information on your own social media platform. So one example is that you're tweeting a protected tweet. So it means that only your followers can see that tweet. So it means that there's poor visibility of it. It's just a limited number of people that would actually see that tweet about COVID-19 facts. Next is what we call public priming. So this is what usually happens for some healthcare professionals, wherein they publicly post or share credible or evidence-based health information to prime people against health misinformation. They actually do this by, for instance, by publicly tweeting about COVID-19 with the CDC link. So they just share that information so that people would actually read that, and hopefully they'll be able to make proper decisions, even without yet being exposed to the misinformation. So they're somewhat priming people so that if people see their tweet first before the misinformation, they hope that people will be able to better judge in terms of making health decisions. The next is what we call the private rebuttal, which means that you try to respond to a health misinformation post by sending a direct message or personal message. So this is what happens typically with family members. So you don't want to respond to them on a public space. So when you see a family member posting some health misinformation, you can actually directly send them a message, a personal direct message to say that what you posted is inaccurate and here's the link to the correct information. So you do it in a private space, but you're rebutting it. So you're making a reply that says that this is wrong and there's the correct information is here. Next. The last method is through public rebuttal, which means that the healthcare professional respond to a health misinformation by publicly pointing out the misinformation and sending credible or evidence-based health information as a rebuttal. So they actually do this on Facebook or Twitter, wherein they actually reply to some of the health misinformation posts, and they actually attach a link to the CDC or other reputable sources to back up their rebuttal. So, based on my survey that I conducted this October, most people would actually correct misinformation. They actually intend to correct misinformation on social media by looking at the blue bars. But if you look at which blue bar has the highest percentage, you would see that they're much more interested in doing public priming and public rebuttal as compared to the private methods of correction. So public priming is not that much different in terms of the public rebuttal in terms of the percentage. So what we can see here is that they're mostly interested in doing public means of correction because people would actually benefit if people see those corrections that are in the public space. So in general, for my phase one study, the implications here is that it provides a framework on how healthcare professionals correct health misinformation, and it elucidates that there are different strategies on disseminating corrections. It's not only like they actually do it on a public space. There are also methods that they do it in a private space. So people can actually choose which correction method they would actually want to do based on how comfortable they are. So the next question is that what are some of the predictors of the correction dissemination? So what predicts whether you would actually do private priming, private rebuttal, or public rebuttal? So that's what my second study is, the survey method. So I want to see what are some of the predictors of healthcare professionals' intention to correct health misinformation on social media. So to do this, I'm interested to see one of the predictors. This is just one of, I'll be only presenting one of the models that I've created for the study, but there are other models that I'm also exploring in the survey. So I'll just presenting one for now. So I'm interested with the role of organizational support because as healthcare professionals, they're not only binded by their role as a healthcare professional, but they also need to adhere to some organizational practices. Some healthcare organizations have social media policies that may prevent you or encourage you from correcting health misinformation on social media. So I want to look at whether the support coming from hospital management, from one supervisor or coworkers, or even patients or clients would influence whether you would intend to correct misinformation on social media on different methods. And since correcting health misinformation is considered to be a behavior or an action, I want to see whether these variables, which are derived from the theory of planned behavior, would actually mediate the relationship between perceived organizational support and the intention. So we have this instrumental attitude, the affective attitude, injunctive norm, descriptive norm, perceived behavioral control. So I'll explain them later based on the results. So I want to look at whether these variables, the theory of planned behavior, mediated the relationship. So I did have some control variables for it, and I used the haste process macro in SPSS to do the mediation analysis. So based on my result, what I saw is that um, perceived organizational support has no influence it's not associated with the intention to correct misinformation on social media in terms of private priming and public priming, but the effect is indirect, which is through instrumental attitude and affective attitude. So instrumental attitude means that if people think that correcting health misinformation is something that's useful for society, affective attitude is that one example item here is that whether correcting health misinformation is ethical to do. So once that they see that there's organization support it, they'll have a much better attitude towards it, and that positive attitude would influence them to do intend to do private priming and um, public priming. But in the case of private rebuttal, it's different. So it's affective attitude and descriptive norm and perceived behavioral control. Descriptive norm means that if people, the observation, your observation, if whether other people perform that behavior. So once perceived organizational support has no direct effect on it, but they would actually influence affective attitude, descriptive norm, and perceived behavioral control. And that would somewhat have an um, indirect effect to private rebuttal. What's also interesting is that um, perceived organizational support has a direct impact on public rebuttal. So if you're gonna do some public rebuttal as a healthcare professional, you want organizational support for it. As much as possible, people who want to be supported by their organization when they do public rebuttal in terms of correcting health misinformation. But it's also interesting that they also need to have a positive attitude towards correcting it. So what we can see here is that healthcare professionals are likely to use public means of correction. As what the survey tells us, they're more likely to do the public methods of correction, which is actually good because we want people to actually see what the corrections. And we see that organizational support and attitudes are crucial for healthcare professionals' intention to engage in public correction. So what does it translate to? It means that we need healthcare organizations to have in terms of policy that they're gonna support their their healthcare professionals when they correct health misinformation on social media. What usually happens right now is that some healthcare professionals on Twitter would actually have this mention in their profile that their tweets are their own and does not reflect their organization. So sometimes healthcare professionals distance themselves from some healthcare professionals distance themselves from their healthcare organizations. So, but in the case of correcting health misinformation, it would be actually good if there is organizational support in such an action, and that would somewhat seems to have a positive impact on their attitude in terms of correcting health misinformation. So overall, what I want to see is that the next some of the results of my phase one and phase two would lead me to whether are these corrections are public means of corrections effective in terms of three target behaviors. I want to look at whether public priming and public rebuttal are effective in reducing COVID-19 misperceptions, vaccine, and would it increase vaccination intention, and would it increase correction sharing of intention? Because it's not only sufficient that they read this, it's also good that people actually share this correction so that more and more people would be able to see such corrections so that they won't fall for health misinformation. So in conclusion, as a summary, um, healthcare professionals perform acts of authentication and correction, and that is what we what we propose in terms of our research conceptual framework that we published in the International Journal of Medical Informatics. I co-authored it with Associate Professor Yan Zhang and Associate Professor Jacek Wifka. Next is that perceived organizational support and attitudes predict intention to perform public correction methods. And finally, the findings can guide misinformation and social media training for healthcare professionals. So healthcare professionals don't really have formal training on this. Sometimes they just learn this on the go. When they join social media, they learn some of these strategies. So it will be good if there will be somewhat a formal training in terms of how healthcare professionals can respond to misinformation and how to manage their social media presence on the internet. And lastly, there still needs to be more research to be conducted to determine the impact of healthcare professionals' correction of health misinformation. So hopefully in the future, I'll be able to present to you the results of my experiment, which is I'm currently conducting by next month. So thank you for listening, and I'm open to questions. Thank you very much.
Thank you, Robert. That was wonderful. Such just fascinating material here. And you've obviously got some great groundwork laid, and I would just looking forward to seeing more about the new work that you're doing. We'll go ahead and open it up to questions. If you would turn your video back on and raise your hand, and we'll get started here. I see Stephen Slota has a question.
Oh, sorry, I was muted.
Yep.
And video's not working out. All right. Hey, sorry, I'm a bit of a mess right now. Great talk. I really enjoyed it. A question that kind of arose to me when I was listening to your talk, and something that occurs to me in a lot of these like disinformation spaces, is the concept of duty. Part of being a physician as a profession is taking the Hippocratic Oath and having duty to provide care in a certain way. Do you see that duty extending to this counteracting of health misinformation in a public space? Is that in your mind a duty of the physician? Yeah. And is that a duty of other professions as well? I'm thinking in terms of librarians here, because part of a librarian's ethic is to share all information equally and freely. And I presumably that might include misinformation depending on who you're asking. So I just, in general, some reflection on like the duty of correcting apparent misinformation, and when and who is supposed to be doing that, as well as like the actual behaviors of it.
Yeah, I got so rich data from my interview that it actually answers that question. It's like whether it's part of their duty. We have a paper currently under review right now that answers that. So the practical answer here is that it's not part of their duty, legally speaking. Legally speaking, they just need to tend for their patients. But there are some people that are very active on social media. To give you a context, most of my participants, like 90% of them, are what I call micro influencers, which means that they have, at least on Twitter, they have more than 1,000 followers. So they see themselves as like shepherds on bringing correct information to people so that they would somewhat prevent the spread of misinformation. And what they usually tell me is that it's not part of their legal obligation, but it's much more of a personal and ethical role as a healthcare professional. They're not legally obliged to be active on social media, but because they have the leverage of social media, they have the power. They are a bit cautious in terms of communicating using that platform. So as much as what they want to do, it's like they somewhat only post correct health information on social media, and to some extent they somewhat correct health misinformation along the process. So the short answer there is that they're not legally it's not legally mandated for them, but they do have this personal and ethical motivation of doing the right thing, because they know as a healthcare professional that they have the knowledge and they have the skill, and they would like to share that on social media.
Thank you very much. Yeah, it's a really complex space when you start getting the legal, professional, and personal responsibility all kind of working together at once. Thank you.
I have another question, Robert. I recognize the differentiation between the public and the private corrections, but other than that, were there any factors that your participants talked about that discouraged them from correcting misinformation at all? Like, for example, certain types of people or certain types of information that they just thought like, I don't want to get involved.
Yes. There are some participants that they just stick to their topic of expertise. So for instance, if I were a pediatrician, I can talk about vaccines, which is for children, but I may have difficulty, or I prefer not to talk about issues about women's health, like reproductive health. But there are some that are generalists, like general practitioners, that they can talk a wide range of topics, but they might be limited to primary care settings. So they somewhat appropriate the way that they correct health misinformation into topics that they consider themselves as somewhat knowledgeable or experts. The next thing is that there are some topics that there are some participants who actually avoid certain topics like vaccination. They actually avoid that because they gonna invite people who's gonna harass them or bully them. I have one participant who she was described as being a child predator or even coddling and supporting the big pharma. So there are certain topics that would make them avoid touching that, but there are some that are brave enough that they actually respond to people that says that vaccines are safe, although there are some risks that the benefits outweigh the risk. So they just have to be clear, and to some extent, sometimes I think the worst that they would actually do is not really be out of social media, but just to block the person if that person is really harassing them. So there are different enablers and barriers that for them to correct health misinformation. And one of the barriers that I see there is that they open up to harassment or bullying.
Yeah, that makes a lot of sense. Does anybody else have any questions? Well, while we're waiting, I just wanted to know, I think something's interesting is in studying misinformation in other areas. I think a particular challenge is trying to figure out what truth people can agree on. What is the truth when you're talking about the news? And finding one source where I think medical information, you have a leg up on those other areas, because within the medical community, truth is a fairly, probably not 100%, but more easy to come to agreement on a larger version of what is true.
So in terms of my comment on that, there's this meta-analysis conducted by Walter wherein he compared studies on different misinformation, disinformation studies that are on different contexts like politics, crime, and healthcare. And they saw that in that meta-analysis is that for healthcare, the corrections are often much more effective than politics, simply because sometimes in politics, it's quite difficult to capture what is the truth. Unlike for for healthcare or for medicine, there's always these studies that would say like, oh, this drug is effective than this. There are some published studies that would show that this is effective for this kind of treatment. But we see that issue having a difficult time for COVID-19 when the COVID-19 was started, because, for instance, WHO initially mentioned that people need not wear masks unless they're in a hospital setting or they're immunocompromised. But later on, they somewhat shifted gears to saying that people must wear a mask at all times, especially when going in a crowded space. So the thing with health misinformation is that it really depends on how fast the science is able to dispute one evidence to another. But the good thing is that for for healthcare or medical information, there is always this truth that would arise in terms of research. This is somewhat different for politics, wherein sometimes we don't really know what's true or not.
No, that's true. Good point. Nitin, did you have a question?
Yeah, and this question is kind of tied to Tara's previous question. So first of all, Robert, good. This is a great talk. I walked in a little late, but you might have already covered it in your presentation of the qualitative aspect. But I would like to hear you say something about what were the perceptions of these healthcare professionals regarding their efficacy in being able to do what they so felt the need to do, like
Yeah.
go out there, expose themselves, and feel the sense of duty. But what was your
There
impression?
are, so we have this under review paper, which I'm revising right now, that in one of the results there, one of the barrier, so we identified three barriers: interpersonal, intrapersonal, interpersonal, and institutional barriers. Within that intrapersonal barrier, there is this sense that what they're doing is something that is not effective. So healthcare professionals think that what they're doing on social media might not have an impact at all. So they might have some imposter syndrome that they feel that, I mean, what they're doing is not, they just do it on social media, but they don't really know. And to some extent, that some of the participants are frustrated with that because, unfortunately, false information spreads much faster than the truth. And sometimes even when they correct it, it gets overdrowned by misinformation. But what they're telling is that they just keep on doing it because this is something that they believe that they need to do professionally. And since some of them would have lots of followers, even though that there are very few people that would benefit from it, the point is that there are people that benefit from it. So they keep on doing it since they have the platform to do it. That's why, that's the reason why the United Nations and WHO set up this campaign, which is the digital first responders, because they want more people to share more accurate health information so that somewhat it would drown the misinformation that's out there. So you want to drown it first before even people see it, or you can drown misinformation by rebutting it. So they encourage more people, and I believe that healthcare professionals would actually be in a better role to actually lead that kind of group because I mean they would actually can mobilize people to share more information. That's why part of my experiment also for my current studies that whether the correction posted by a healthcare professional would they intend to share that because I believe that this kind of corrections need to be shared by a lot of people so that they would have an impact.
Thanks, Robert.
I think we have time for just one really quick question from Christina before we have to close up for the day. Oh, Christina, you're muted.
Sorry about that. So I have a quick question, Robert. You were talking about in your experiment that uptake of correction. Is that something that you're looking, and that I kind of want to talk more or wanted to hear you talk more about that. Are these posts actually drowning out the misinformation that we're seeing? You know, sometimes we get caught in our own little echo chamber of our followers, and you know, they might, like you said, they already know, they're already prone to the correct information, but are you seeing that the misinformation is being drowned out by these posts?
First is that when dealing with the echo chamber, it's a much more complicated thing because for typical social media users, we couldn't really influence them who they can follow. Sometimes they would actually follow who they think is correct, and that would create the bubble. But in terms of my experiment, I plan to disseminate it on MTurk. And I do have some filtered questions that I'm gonna only recruit participants that are vaccine skeptics. So there are some filtered questions that whether, for example, I ask them, do they think that vaccines outweighs the benefits and it's more of a risk? So if they answer definitely true and probably true, I'm gonna only recruit that in my experiment because I'm focusing more on the vaccine skeptics. So at least on an experiment level, that's how I would actually do it. And I'm gonna expose them to different tweets. So simulated tweets. One is just a priming, wherein there's this person who would actually post health information that is correct. And there's this person who's gonna post something which is on the right that has some conspiracy kind of message. Then there's this reply, which is a public rebuttal. So I want to see whether which correction method would influence people to share that correction and would also enable them to sign up for vaccination for COVID-19. And which ones these correction methods would actually reduce their COVID-19 misperceptions.
Thank you. It's a great talk. I appreciate it.
Thank you. Welcome.
Yes, thank you to all of you who have been here today. Thank you especially to Robert for your great presentation. And I just want to sign off by saying, please join us for our next presentation on April 26th. That will be by James Hodges. and he'll be talking about supporting medical maintenance labor under as epistemic conditions of COVID-19. So I think we'll all be interested in that. So thanks again to everyone for being here and have a good day.
Thanks, everyone.